Why can't we get a straight answer on how long dental implants are supposed to last?
There's several factors that go into things in order to keep them around for a very long time.
And does it matter who's actually involved in the surgery part itself?
Frequency is also important, experience.
How much control does a patient actually have over their long term success?
It's a very important factor.
Dental implants are an investment, so understanding what affects how long they last matters when choosing a solution. So today, I'm sitting down with Dr. Lakhani, a restorative doctor at Nuvia, to break it all down.
All right, let's get into it.
All right, so dental implants are often described as permanent and have very high success rates, but why can't we get a straight answer on how long dental implants are supposed to last?
Well, I think that's because permanent means in our language something that's long term and built to last. And survival rate actually means the fusing of the implants, the osseointegration with your bone at 4 months. And so when you hit that mark and you have that fusion occur, that's described as implant success. And thereafter, there's several factors that go into things in order to keep them around for a very long time.
Interesting. Okay, so what are the factors that can affect how long they do last?
There's a difference between single implants and full arch implants, and also how the surgery is performed, how the procedure is performed, how the teeth are made, how everything comes together, the skill sets and the teamwork. And also, the patient is going to be responsible for a little portion, which is to maintain them as best as they can with certain lifestyle changes and oral hygiene.
So, can the, implant solution actually affect how long it does last? What options are there to choose from?
Depending on the patient's needs, if they are a candidate for, say, something that Nuvia does, which is a full arch replacement or a full mouth replacement, in that configuration, I think technique matters more than if you're just replacing one tooth or an area of the mouth. When you're getting this full mouth replacement, usually the older way of doing things before technology had gotten up to speed and things like that, and us having so many capabilities in house, temporary teeth were the only things that could be delivered, and they're made out of acrylic on the after the surgery. And final teeth were then made after complete healing of the bone and the implants.
And how long does that usually take? Or can it take, I guess?
It can take up to 4 months. And so that would be 4 months of wearing a temporary prosthesis.
So, when it comes to, full mouth, like the full arch is what you were just talking about, how does the process or materials used actually factor into how long it lasts?
In Nuvia's way of doing things, we do not like temporary teeth, and there's a reason for that. That's the material that we choose to start the healing journey with is the final material. Um, and that's because temporary teeth can tend to break. And that's a very critical healing time when the bone is still welcoming the implant in and that fusion is occurring over those first 4 months. And if you're in a temporary set of teeth, that can break, that can disrupt the healing as well. And we've seen that affect survival rates, statistically speaking. Whereas within Nuvia, we have a confirmed survival rate of 99.1%.
And when it comes to Nuvia, you said that somebody is getting their final right away. Does that mean like right after surgery or like how long after surgery are they getting that final set?
So the lab does have to fabricate the teeth, but they work so effectively that they can do this in 24 hours, which is really unlike any company I've ever seen.
And how does someone know if they are a candidate for, this process that you're describing? Is there like a easy way to find out if you can be one?
So taking that 60-second quiz in the link below is definitely the best way to get started with us.
Awesome. Well, let's move on to the way the procedure is actually done. Can the way dental implant surgery is actually planned or performed actually affect how long it lasts?
Absolutely. And so, as we were talking about in full arch dentistry, technique matters a lot because everything is supporting everything else. It's all one. And so, it has to be cohesive. And so, the more cohesive your team is, the more cohesive the dentistry is going to be as well. And so, the planning is very crucial. We have a lot of amazing software and intraoral scanners that we use to really plan the surgery from before it even happens to not leave a lot of things up to chance. And the implant placement is done in a very specific way so that everything can be supported well for a long time. And of course, the way the teeth are designed, the way the prosthetic is made, should be built to last and should be, comfortable and aesthetically pleasing and all those things that patients look for.
And does it matter who's actually involved in the surgery part itself? Like, how does that work?
Right. So, teamwork is the dream work, cohesiveness, everybody kind of being responsible for their area of expertise rather than having one person trying to do a bunch of things. And so, I think Nuvia does a very good job at dedicating personnel in this one procedure. A lot happens in a short amount of time, and a lot of people have their hands in that as well. So, the CRNA is responsible for the comfort and safety of the patient. And with that general anesthesia component, the surgeon can focus just on the surgery itself and not have to worry about the condition of the patient during sedation. And then, of course, the restorative doctor is going to be the one who's responsible for putting the teeth together and getting the patient the satisfaction that they want.
And when it comes to, the experience level of the doctors, I'm sure that kind of factors into it too. So can you kind of walk me through what that looks like at Nuvia, maybe versus, maybe a general dentist that does implants as well?
Right. So frequency matters a lot, training and frequency. So we've all been very trained and we've all been selected for that reason to do full arch or full mouth implant dentistry. And so Nuvia does a lot of what we do. We treat a lot of patients. Every center is very, very busy. And so when you're doing the same thing every single day with, results that are consistent, that's a provider that you can trust like you would with a family member.
Absolutely. And you did say the success rate was over 99%. So I feel like that goes to show what you
Right.
guys are doing. So that's pretty awesome.
Absolutely. It's hard to get much better than that when, when biology is involved and there's other factors in play. So that's amazing. Definitely.
And you did mention earlier there's an in-house lab. How do you think that is helpful in this whole process? Is it usually like if you were to go somewhere else or do it the traditional way, are you usually outsourcing materials or what does that look like?
Yeah, so that's often why other places might wait the 4 months, because there's a lot that they have to do in order to produce the final restoration, a lot of outsourcing. And so that takes time to put together. Quality control is more variable, but when communication is in-house, things can be done so much more efficiently and effectively.
Why do you think that affects long-term outcomes? Why do you personally decide to work with Nuvia in the way that they do it?
Is the teamwork and the cohesiveness, it really makes it a dream, and the surgeon will say the same thing. The surgeon will say, "I love focusing on just surgery," and likewise, I love focusing on my skill set, which is designing the teeth or fitting the teeth. And so it really helps when your mind isn't split into multiple places, and I think that makes practicing so much nicer.
Yeah, I mean, I can imagine a lot of people come in with probably fears of the dentist too because they've had bad experiences in the past, and being able to possibly reduce that time you're in the chair, and getting it done in 24 hours,
Yeah.
that sounds like a good deal.
Yeah, yeah. dental anxiety, we're no stranger to that. It's unfortunate because of the way dentistry has been done for decades, but we, also love blowing their mind just as much, as much as we like making them feel safe, once it's all done.
Absolutely. And before we move on, if this video has been helpful for you, please consider subscribing. It helps us reach more people who are looking for clear, honest information about their dental health. Well, let's talk about, after the surgery itself now. Does the way the patient takes care of their dental implants actually affect how long they last? Walk me through that part of it.
It's a very important factor, the surgery can be done very well, the teeth can be designed very well, but at the end of the day, we're still living beings housing that dentistry, and so that's the biological component. And so just taking care of the environment that the implants are in is so critical, in my opinion. And it's not very hard to maintain. It's just a matter of protecting your investment, is what I like to tell patients, just water picking around. Actually much easier to care for than a natural set of teeth that you have to floss in between and such. So if you just do your due diligence, twice a day, flush everything out with a water pick. We see amazing gum responses whenever we do follow-up cares.
And how often is there follow-up at Nuvia?
So coming to your follow-up cares is very important, just as it is if you have a natural set of teeth to go to a dentist for checkups, just to monitor things, because again, it's biology. Biology is ever changing. Once a year is what we advise. At 4 months, there is that checkup as well. There's a 2-week follow-up as well, but in terms of maintenance, once a year, just to make sure everything is still spick and span.
Nice. Yeah, I'm like, I go to dentist, what, every 6 months? So that's even
Right. It's
less.
less maintenance, in my opinion, I would say, for sure, yeah.
Nice. Well, is there any other, lifestyle habits that people should know about that could affect, the longevity of their beautiful new smile?
Yeah, so, habits that we kind of have built into us, like teeth grinding and clenching, that's why we give every single patient a night guard so that they can protect their teeth during the nighttime, which we can't really control what we're doing. But then when you're awake, if your habit is to clench, you can kind of catch yourself and release your jaw. Also, diet is an important thing, not eating very hard foods, even for a natural set of teeth, just in good conscience. We want the patients to be able to enjoy their teeth and eat whatever they want, but just in good conscience, not to do something that feels like it could damage your teeth. And also, I would say anything kind of stickier, sugar, extra sugar, it's just not good for inflammation anywhere in the body. Stickier substances are harder to clean out from underneath the prosthesis, and they can harbor. I think the major thing that we really try to impress upon patients from the get-go is smoking. Nicotine or cigarettes, carbon monoxide, all of that is such an offending factor to the environment that implants are living in. And so even if the patient can't necessarily quit, off the bat, just working on that journey of cutting it down, finding alternatives, reducing that as much as possible, it really goes a long, long way.
Absolutely. So
Yeah.
you did bring up, eating harder foods. Is that why there's typically a soft food diet at first during the healing stage? Because if you're trying to eat something more difficult on your implants, it could cause some movement or can you explain that for us?
Absolutely, yeah, and it's a lot of this is just practical things that we can all relate to. And so when the implants are fusing to the bone, the idea is to not disrupt that and to kind of keep things as solid as possible, which is why wearing temporaries can affect healing. Because if they take an impact that they cannot tolerate, and the temporary can break, that force can be transmitted to that implant bone interface.
Mm,
And so just the teeth, that the final teeth are so capable of cutting through everything. It's kind of up to the patient to really hold back just for those 4 months when healing is most critical.
absolutely. That makes sense.
Yeah.
That makes sense. So I am so curious if somebody, gets it done, it's mapped out really well, they get the surgery, they take care of them. How long are they supposed to last? Like, I know maybe there's not this specific answer, but like, what would you say to that? How would you respond?
Well, to that, I would respond with research, because research is the best test or evaluation of time. Um, and there are many articles that one could look up that full arch dentistry as a whole has been proven to be very effective. In itself, it's not more than 20 to 25 years old, which is why the studies only go back to 20 to 25 years, but majority of those studies will boast survival rates of at least above 90%. And whichever patients had to, have any kind of redo to their work, it also discusses factors why that has happened. Because if you think about it, it's in your mouth every hour of every day. And then when decades add up, those daily habits really are what make it come full circle,
Mhm.
and so it discusses everything that we kind of discussed, just having a good lifestyle to support your implants.
Absolutely. And I can imagine, some of these patients that have come in before have maybe tried other solutions that may have broke or failed or when it comes to maybe dentures or root canals or all this sort of thing. So I guess when it comes to like full mouth dental implants, they're looking for a permanent solution. So it sounds like this is going to last them a long time when it comes to a dental solution.
Yeah. And in general dentistry, when you're repairing each tooth, it's hard to predict how long each tooth will last. But with this, everything is one piece. And if designed well and if executed well, you can just rely a little bit more on the prognosis or the longevity of that than traditional dentistry. In my opinion, in my experience, it's more predictable, and delivering results is more predictable. Yeah.
I would love the more predictable option, that's for sure.
Yeah. Especially if you're a candidate, yeah, it's a beautiful thing to be able to do for patients in the modern day.
Dr. Lakani, thank you so much for helping us break this down today. If you want to learn more about how permanent teeth in 24 hours compares to the more traditional process, we break that down in the next episode. And if you want to find out whether you could be a good candidate for dental implants, make sure to take that 60-second quiz linked in the description below. And until next time,
Keep smiling.